Hi everyone, welcome to GGN or Global Government News. Today's Saturday, December 12th, 2020 or 12/12. This is my website, ggnworld.com. The ggnonline.com and .net, that's long gone. But I was able to get this domain for this one. I also have a .org, so ggnworld.org. You can put in your email address here to get updates when I post to that. Just in case, you might want to try that because you never know how long these YouTube channels are going to last. I really don't depend on them being there for too long. The DDarko 2012, the original channel, and then of course DDarko 2013. My goal would be to have a website that's kind of self-sustainable to where you can just go to the website and watch the videos. I think most people just watch them on YouTube, but the time will come where both these channels will be gone. We've already seen this channel be gone, and then for 6 years I think it was, and then somehow I was able to get it back. So just like my website, I was able to get some kind of domain for it as well. I created a new Twitter account, Global Government News. It's actually called Global Govern Me 1. So that's another way to get some updates if YouTube goes down. Alright, so like always, I have a bunch of articles to get to, and I won't get to all of them in one video. But this is mostly about the vaccines. So the good news is the vaccines are here. They're on their way. This is months and years in the planning. And just like 5G, these are the vaccines that America has been waiting for. This article, Boris Johnson says tougher lockdowns are coming until gene-altering vaccine is ready. He warned against over-optimism, which is being fed by the mainstream media along with fear, and then optimism that the vaccine is going to save them and end this pandemic. He braced the public in England for difficult months before the cavalry of science comes to the rescue and finally ends the crisis. He said things will look and feel very different after Easter with a vaccine and mass testing. He said the months ahead will be hard, they will be cold, they will include January and February when that blah 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 is under the greatest pressure. It'll be a dark winter, and that's what they're all just parodying the same stupid phrase, the dark winter, and that from the exercise that took place a long time ago. But talking about things will look and feel very different. I guess if you take the vaccine, that you might feel very different if it is going to alter your genes, and society itself will look different because this will just become the new normal. The whole goal, the whole purpose of this supposed pandemic is that it never ends, and that the vaccines will continue. It will just be multiple doses of vaccines. You have to get your basically vaccine passports or certificates will expire, and you'll have to get them updated every year in order to work, in order to shop, in order to travel. Fauci, unless Americans take the vaccine, the masks need to stay on. He says that face masks are here to stay unless enough Americans get the coronavirus vaccination. And even if they take it, he says, then it will take at least 6 months before the mask can be left behind, which I don't think they're ever going to go away for good. Beginning of the end for pandemic, as vaccine arrives in the UK, so it's the beginning of the end. There's another propaganda piece. The end of the pandemic is now in sight. A year of scientific uncertainty is over. 2 vaccines look like they will work, and more should follow. It depends on what you would define as work. It'll help prevent spreading the virus or getting infected. From what they're saying, no, it's not even going to work. So there's a lot of hype over nothing. But it might actually work at doing damage to your body, including causing infertility and other issues, permanent side effects. So the scientists and experts are encouraging Americans with pandemic fatigue that it's the last inning of the game. Don't quit. Keep your mask on. And then they just go into more doom and gloom about how experts expect to get much worse. It's going to get much worse in the following months before a vaccine is distributed. That's because it's flu season. People get sick every single year around this time. Doctors are tired. The nurses are tired. We're all tired. We're all in this together, guys. But they say coronavirus measures will not end when vaccine arrives. So that optimism that we keep hearing about, there it is again. Optimism. Much needed optimism. The vaccine's going to save us. The coronavirus measures will not end when vaccine arrives. Not me, a conspiracy theorist, saying it. Now, I'm not spreading misinformation, as YouTube will say, and pull this video down. This is them. It's coming straight from the experts. For starters, a vaccine may not be 100% effective. Face covering, social distancing, hand washing, and blah 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 required for some time. It all depends on how good the vaccines are and how long the protection lasts, and that's what I'll get to. I think it's about 9 months. Regular flu vaccines, for example, have ranged from 60% effective, and then of course the different viruses and strains in that are mutating. So by the time they usually get them developed, they've already changed and they're useless. So it says here a partially effective vaccine might help high-risk groups such as frontline workers and blah blah blah, people with health problems, but it might not be right for the general population. This is coming from former FDA chief scientist. Certainly that's not the vaccine you would ideally immunize 300 million people with. Even if everybody was vaccinated, that's probably not enough immunity in the population to stop the virus from spreading. And this is going off what I mentioned in my last video about Fauci saying that all this vaccine will do is mask the symptoms, the flu-like symptoms, this cough, sneezing, whatever. But it's not going to help prevent the spreading. So some experts call this worst-case scenario vaccine that works well enough to prevent patients from getting sick, but not well enough to stop them from spreading the virus. And this is their logic, and this is why they're going to say you have to keep your mask on, you have to keep social distancing, all this stuff has to keep going when people finally take these vaccines that they've been waiting for so they can go back to normal. And they're going to say, no, you're not going to. There is the risk that even the vaccinated people may unconsciously spread the infection. So, I got vaccinated, I don't need to wear a mask, and I don't need to wash my hands and all this stuff. But they're telling you that you can still spread it. Moderna vaccine may not stop people spreading COVID. This is from the Metro. The Metro, basically, UK. Their website, it's mainstream, so nothing crazy here. This is the chief scientist of Moderna. He urged people not to overinterpret the promise of the vaccine, though he said he believes it should prevent viral spread. And they go through the science of how it works and how it's different from regular flu vaccines. They say it doesn't kill the virus, it just latches onto cells and drains its power. So they can't replicate. But it says, but Moderna hasn't proven that, and Pfizer hasn't in its trials either. It was back in October 26, 2020, Fauci saying early COVID-19 vaccines will only prevent symptoms and not block the virus. So they've been preparing people for this in the news, if you pay attention. That this isn't going to be the savior, that all of these restrictions aren't going to end. COVID vaccine may only last 9 months, and we can't ease restrictions before March. This is from the Mirror, from the UK again. And England's chief medical officer said that Brits may need to be vaccinated repeatedly. When I read that, I just shook my head. I'm like, okay, because you're basically guinea pigs if you take this thing. They don't know what it's going to do. It's experimental. He doesn't know. He doesn't know yet, but it's unlikely the country will ever hit zero risk from coronavirus. And so that they're telling you where it's going to go. When you hear people like, I think it was de Blasio or Cuomo saying that they're not going to end these restrictions until there's 0 cases. But they're making it sound like this is never going to end until no one gets the flu. Ever again. COVID vaccine hesitancy widespread, even among medical professionals. Well, public health groups, which including the World Health Organization, which are backed by these pharmaceutical companies making these vaccines, including Bill Gates, are making a concerted effort to reduce COVID vaccine hesitancy. In other words, they're putting out all kinds of misinformation in the mainstream media, using their outlets to try to convince people to take something that really they shouldn't be taking, that's not really good for them, as many medical professionals and minority groups remain doubtful about safety and whether it even works. So people like the WHO are stepping up efforts to build vaccine confidence through public relations, that's propaganda, and communications campaigns. Washington Post reported they found that 2/3, 66% of healthcare workers intended to delay vaccination, meaning they do not intend to get the COVID vaccine when it's available. So this one is in blatant marketing gimmick. Pfizer claims vaccine is now scarce. So by making it sound like there's not enough, people will want it more. That's kind of the reverse psychology, and they've done this before. They try to trick people. It's really evil. This is actually from Psychology Today. 4 ways to use scarcity to persuade and influence how to make a choice more desirable and appealing by making it scarce. And they know that people don't want it. If they're putting out articles like this, how to convince the public. And so, a harmless dinner party ended up killing my dad. And so now you're going to get all these articles. Yeah, they limited their social interactions, blah, 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 blah. Life had to continue. Damn it. Family members film PSA urging people to stay home after 15 of them get COVID-19 following a birthday party. We feel guilty for gathering. And then they show this picture. It looks like a woman dying in the hospital. And then you read the first paragraph, and it says that 15 of their family members tested positive. And with that last article about the dad dying, I mean, this is him. He's not exactly, 30 years old and an athlete and in great condition or anything like that. It happens. It sucks, but they're using these stories to maintain that narrative. Sadie Robertson, I don't know who that is. I don't really care. Says COVID spread like wildfire through her family. Rachel Maddow. Her story about her partner's bout with COVID-19 convinces people to cancel travel plans brought me to my senses. She's basically saying don't travel and don't go to family events anymore. 250,000 Americans have died from COVID-19, and it didn't have to be this way. Like that one article I covered, we blew it. It didn't have to be this way. If we would have just stayed locked up in our houses for the last 9 months and never left and just completely shut down the economy, we wouldn't be in this situation. So how are they going to convince the public to take the vaccine? Here we go. Just keep continuing. The U.S. could face an apocalypse by Christmas as COVID-19 cases surge. People getting sick and dying? No. They don't mention the death rate, they just say cases. Hospitalizations hit new high in the U.S. at 86,000. Is that people going to get tested, coming back to get tested or get vaccinated or anything? No, they're not really saying. COVID-19 has brought healthcare system to the brink of failure, doctors say. It's panic porn clickbait. Media scare stories about hospitals are misleading. It says we're back in the media scare stories about the hospital stage. The good news is, just like last time, that's simply not the case. They either have no idea what they're saying or are seeking to mislead. Just one example here. Hospitals in Idaho, Pennsylvania, Texas overwhelmed by COVID-19 patients from December 5th. It says that's a scary headline. It's also false. We have the data. It says in Idaho, as of 12/4, 57% of inpatient beds used. 14% of them were COVID. 74% overall were ICU. 90% of inpatient beds in ICU is normal. Even 100% is normal. 57% is staggeringly low, like they're going out of business. So in other words, they want those numbers to be high. If they don't have people in beds, in rooms, they're not making money. In Pennsylvania, 17% were COVID patients, 73% all beds, 82% all ICU. Interesting little headline here. John Hopkins pulls article admitting that coronavirus has not raised the total U.S. death toll. So this guy was looking at the data before and after the whole pandemic started. Surprisingly, the deaths of older people stayed the same before and after COVID-19. Since COVID-19 mainly affects the elderly, experts expected an increase in the percentage of deaths in older groups. However, this increase is not seen from CDC data. In fact, the percentages of deaths among all groups remain relatively the same. So these numbers indicate that the number of deaths was normal long before COVID-19 emerged. He also said that the number of deaths by COVID is not alarming. In fact, it has relatively no effect on the deaths in the United States. This is not misinformation. This is coming from John Hopkins. These are the ones at the top of this whole, I guess you would call it conspiracy, pushing this. This is an assistant program director of applied economics master's degree program at Hopkins University saying this. 4 days after this article was posted, they retracted the article saying that it was being used by people to spread false information about the virus. So if you repeat what they say, it's misinformation. This article did mention about heart attack deaths being labeled as coronavirus, and we'll finish up with this. Study identifies thousands of deaths caused by heart disease and stroke during COVID-19 pandemic. That's 2,000 excess deaths. That's people that died that didn't have to. They could have been prevented had they had access to the hospitals. that were supposedly overloaded with COVID patients. This is GGN. Thank you.